Hey, thanks for joining us. Joining us in our conversation now is Dr. Beth Templin. She is a leading geriatric physical therapist in St. Louis. She helps older adults move and feel better, and she does that through the use of exercise as well as traditional physical therapy. Doctor, thanks so much for spending some time with us
Thanks
today.
for having me
First
today.
of all, give me a little backstory here. Where are you from? Are you from this area? And how did you get here if you're not?
I am not from St. Louis. Don't hold that against me. But I did come here to go to WashU for physical therapy school, and I happened to meet my husband while I was going to school here, and now I'm a St. Louis girl. But I'm originally from Ohio, from the Cleveland area, and just looking to go to grad schools. I chose number one, and they accepted me.
That's an outstanding school.
So
I don't think
went.
in St. Louis we fully appreciate what a gift we have in Washington University and the PT school within that.
Yeah, I think I know that when people ask me if my degree impacted where I got hired, I'm like, St. Louis is so saturated with WashU, it doesn't make much of a difference. But I got an amazing education there, absolutely.
Well, doctor, tell me a little bit about HouseFit. What is that, and how are you associated with it?
Yeah, so HouseFit is a business I started about 5 years ago. I had worked in geriatrics for about 13 years, and I kept noticing that people didn't have access to the kind of services that they really needed to stay active and independent, to enjoy their retirements, to age in place. And so I just felt really driven to kind of create something new, to kind of fill that gap and fill that need, to create new programs and services to serve the aging community in a better way.
HouseFit is an intentional name. I don't suppose anybody who has a company has an unintentional name, but I love the name, HouseFit.
Yes, it literally means, are you fit enough? Are you healthy enough to continue living in your home long term? Because most people want to age in place. They don't want to have to move to assisted living and to a nursing home. And so how can we do that? We can create better services for them.
We want to stay in our homes.
Yes.
Is it the case that we underestimate what it takes?
Yes, I think so. The number one complaint of aging is difficulty with walking in stairs. And once you start struggling with walking in stairs, you struggle to get out into the community. And then you also start to struggle to live in your own home. And that's where physical therapy can come in. We are the perfect person to be on your team to help you navigate that.
Before we dive deeper,
Yes.
Is it the case that people undervalue the effectiveness of physical therapy?
I think they do. I think most people think of physical therapy as an afterthought, after I have surgery, after a knee replacement, after I get sick. And they don't realize that we can really focus on prevention and wellness. At HouseFit, we actually have an entire side of the business that focuses on it. It's medical fitness options for folks to use not only after they've completed a therapy, but for those folks who are proactive and are really looking to slow the aging process as much as possible. We've created programs just for that.
Have you run into people who are not just surprised, but shocked by the difference physical therapy makes in their mobility?
Yes. I mean, my job is my happy place. I walk in every single day and our clients will pull me aside and just tell me what a positive impact that our services have had on their lives, their loved ones, their ability to travel, to get back out on the golf course and to do the things they love to do. And it just makes my heart so happy.
When I turned 30, when I turned 40, when I turned 50, I hit all of these ages and I thought, what is this? It doesn't seem to make any difference. When I hit 60, I could tell the difference. Mm-hmm. So the question, I guess I'm sort of beating around the bush here, but what do you want folks to know about aging?
Yes. I think the biggest thing that I want people to know is that there are so many myths out there about what normal aging looks like. People assume that it's normal to have declines year after year, and so they accept it as a normal part of aging, instead of understanding that that's not normal aging, but it's typically what we call accelerated aging due to inactivity, due to illness, or due to injury. Most of us tend to be less active as we get into our careers, as we raise families, and that's cumulative. We're less and less active, and then all of a sudden it shows up as what I could do just last year is a little bit harder this year, or I can't do it at all. But people think that's normal aging, and so they don't seek out help or services when they potentially could change that aging trajectory.
What about fear? I'm afraid of pain. I don't want to suffer all that pain. It's just better and easier if I just sit here and then I'm not in as much pain. What would you say to that person?
There are so many people that avoid things that make them nervous, and pain is one of them. And oftentimes we become more painful because we are less active. We say that motion is lotion. So especially for arthritis pain, one of the best things you can do is move more. Now, you might not be able to pick the right kind of activity on your own. You might need a healthcare provider like a physical therapist to help you get that journey restarted and get you back on track. But when you go to the Arthritis Foundation, the number one intervention that is not surgery, that is not injections, and that is not as pain pills is movement. And so finding the right person to help you get moving again, there's no reason why you have to be afraid of or live in chronic pain.
Okay, so I'll just deal with my own situation. I have arthritis. When I'm moving, I feel better. If I stay in motion, I kind of don't even notice that I have arthritis. When we're done with this interview and I stand up, I'll know it. How do I convince somebody else who's not prioritizing their fitness and their health? Or even me, how do I raise the priority?
Absolutely. So most of the people that we work with, their biggest fear in life is losing their independence. Most people want to stay living in their homes, living their life, taking care of themselves and their loved ones. They don't want to become a burden on others. That is how you prioritize fitness. That is how you work through some of the fears and the aches and pains, because the alternative is losing the independence and then having to rely on others.
Oh, that's really interesting.
Yes.
You don't want to be a burden, and you don't want to leave the house.
And people won't oftentimes do it for themselves. But if you say, but then your daughter will have to start doing your laundry, or your son will have to come start mowing your lawn, that's the big motivator. So sometimes people don't have enough in them to do it themselves. But when they think about the idea of becoming a burden on somebody else, that might be enough to get them kind of kickstarted and moving in the right direction.
And if someone is a little bit stuck, what's your first conversation going to be like with them?
I think a lot of it is understanding what their personal fears are, what they've tried in the past and failed at, maybe what their goals are, and see how our services can align with them. I think the biggest thing is when people come away from working with us in the gym or having one of our client or therapists go out to the house, is we give them hope.
I love that. You know, we have these prejudices in our culture, and one of the prejudices is against older folks, and it chips away at hope.
Yes.
What are the components for somebody who wants to work on their strength? Okay, so I'm on board.
Yep.
I'm buying into this whole Dr. Templin thing. But
yes.
So what are the components to this journey?
So I think what most people are missing, even folks who might be like you who are a little bit more proactive, is intensity. When we prescribe exercise, it's all about not just intense physically, but intense mentally. It has to be physically and mentally challenging. And for some people, the idea of driving intensity for old people is terrifying, or it might seem dangerous or not like a good idea. But so much of that is rooted in this ageism, all these false beliefs we have about what is appropriate and safe for older adults to do. But the reality is it does not matter what your age is. Your exercise needs to be hard. It needs to be challenging. You need to be huffing and puffing. You need to break a sweat. Otherwise, that exercise is not going to be appropriate for you.
Is there a connection between anxiety and fear and trepidation? I guess that's just another word for fear.
Yeah.
Working out, doing physical therapy, is there a connection between those? Will I feel less of those things if I'm more active?
Yes, absolutely. And I think part of it is what we do is things like graded exposure. So if you're really nervous about getting on the floor again, maybe we'll have you kneel on a chair just to get used to having weight through those knees again. And then we take it to a mat table, and then we get down to the floor on some cushions. So people who are very fearful of something, we slowly dip the toes in the water. We kind of get them used to the idea. We build confidence and strength over time, and then we tackle the big thing that they're really scared of. I think, too, so many people have been brushed off by our medical system. They have been ignored. Oh, it's normal to be dizzy. It's normal to be painful. It's normal to have balance and falls. You're lucky to be alive. Here's a walker. And they don't see the potential or the possibility that people have. So they feel frustrated, or they tried and they failed in the past. And that's where a lot of that fear really comes from.
Well, you know, I also was a person of a certain age that I am no longer. And sometimes it's a little embarrassing to not be able to lift the weights I used to be able to, or to go to town on the treadmill or exercise like I used to be able to. is shame something you got to get me over the hill for?
Yeah, I think it just depends on the person. But the beautiful thing about what we do at HouseFit, during our therapy services, we work one-on-one with all of our clients. So we get to really get to the root of what is your barrier? What is stopping you from moving forward on your fitness journey? Is it pain? Great. Is it strength? Is it fear? And how can we work with you as your partner to get past that?
So what is the working with you like? What does that look like? Take me through a consultation, assessment, visit.
Yeah, so we actually offer a free assessment for anybody that's new to our world. It's an opportunity for you to sit down with one of our physical therapists, and we find out what you've been struggling with, what you've tried, what your goals are, and we'll maybe even do some testing to kind of figure out how big or small the problem really is, and then we can make a recommendation for our services. For some, that's going to look like the one-on-one physical therapy, which we offer at our South County clinic, and we also have a dedicated mobile therapy team that can service the entire St. Louis area. We also have all of our fitness options from beginner level to really high intensity, and we can kind of figure out which one of those services is the best fit for you. And then ultimately, it's up to you to decide.
It's been my experience that a close caregiver will sometimes learn something, doctor, that the patient isn't necessarily going to confine into their primary care physician.
Yes.
So you're a wealth of information in both directions, aren't you?
Absolutely. We truly see ourselves as advocates for our patients. We often identify medical issues and other medication issues, other resource issues, caregiver burden issues. And we have such a great resource of network of resources, and we just refer out whenever possible so that we're treating the person as a whole person and not just as a knee pain patient.
What about the other members of the families? I would suppose you're working with the adults, but what about the adult children?
Oh, occasionally it's the adult children that find us and that advocate for their parents to seek us out, or they're the ones that are bringing the parents to and from classes or just really helping to be that second support. But yes, we work with all members of the family. We work with paid caregivers. It's really whoever is part of that care team becomes part of our family.
Well, doctor, if somebody wants to reach out to you or your care team, what's the best way to do that?
Yes, so the office is 314-939-1377. And we also have a wealth of information on our website, including some free guides in case you're just wanting to learn a little bit more about how we work, and that's housefitstl.com.
housefitstl.com. Mm-hmm. That is awesome. Dr. Beth Templin, geriatric physical therapist, housefit.com. Thank you so much for the gift that you give to us and for spending some time with us, and thank you for spending time with the doctor and I.